So let us start another toxicant, fluoride, and therefore the toxicity is known as fluoride toxicity. Regarding fluoride, we all aware about this element, fluorine, that is a high electronegative element and therefore very reactive non-metal. And because of its electronegativity, this fluoride is having capability to bind with calcium, iron, aluminium, manganese, magnesium, and other divalent cations. And therefore, this is responsible for toxicity because of its binding capability. Regarding its toxicity is concerned, not only in India, fluoride toxicity is occurring, but this is occurring worldwide. And amongst the worldwide, it is about 25 countries in this fluoride toxicity is endemic. So this is very, very important. And particularly the acute fluoride toxicity is mainly occurred, and the acute fluoride toxicity is known as fluorosis. So this is very, very interesting as well as important because many part of the India where the soil is enriched with the fluoride, that means ki water is also rich with the fluoride, and therefore with water fluoride is coming, and slowly it will produce fluorosis in human being, and therefore this create a very big problem in the human being where the society are residing nearby the soil or water, the fluoride is high. So this is very, very important. Regarding animal is concerned, this is also very important. So now we have to go through one by one about the fluoride toxicity. So the exposure is concerned from where we are getting exposed with the fluoride, or what are the source of this fluorides are. It may be from the industry, it may be from the natural. So in industry, there are many industry which are producing fluoride are like aluminium, like steel, like mineral supplement industry, fertilizer industry, then the power generation station that is generating by the coal, then the brick manufacturer, then the cement factory, then the glass manufacturers. These all industry are going to give the effluent fluoride, and therefore it is the one of the most commonest industrial way of toxicity with the fluoride. So this is very, very important. So if the soil is rich in fluoride, that means ki from the soil it is coming in the water, and therefore even the deep wells are having high fluoride where the soil is enriched with the fluoride, and therefore usually going to produce the chronic fluoride toxicity called fluorosis. Other natural sources are soil, then water, also in air. So automatically from the soil it is coming in the plant, and this is also in the animal tissue. So these are the natural sources of the fluoride, and from where animals are getting the exposure with the fluoride toxicity. So usually, as we already mentioned, there are two type of main toxicity produced by fluorides are acute toxicity and chronic toxicity. So chronic toxicity is also known as fluorosis. Regarding the acute toxicosis of the fluoride is concerned, this is rather rare because rarely we are getting high concentration of fluoride exposure, and therefore it is rare to occur the acute fluoride toxicosis. So the compound usually we are using for the therapeutic purposes, they or you can say other purposes, they may lead to acute fluoride toxicity are sodium fluorosilicate. This is used as a rodenticide. So by any means animal got exposed with this, then there may be chances of acute toxicity. Then the sodium fluoride. This is very much used as also in swine as a scaricide, and other source where the fluoride are high concentration, which are usually natural, are from the water, from the vegetation, from the feed, and if the concentration are high, then the chances of acute fluoride toxicosis occur. Regarding chronic fluoride toxicity is concerned, the chronic chloride toxicity is mainly because when the animal are going to take this slowly and slowly for for months or for years, then this is going to produce the accumulation of fluoride and thus lead to the chronic toxicity, also called fluorosis. So chronic fluoride toxicosis or fluorosis. So most often affected herbivores are cattle, and this is maybe by consuming the forages which is high in fluoride content, that is grown where the soil is enriched with the fluorine. Then also, as we earlier mentioned, the drinking water from there, the fluoride is also high there. Then industry is also that we earlier mentioned, industry like cement factories, like fertilizer, like the power station generating electricity by the heat, like that they are the source of the fluoride and therefore produce the fluoride toxicosis. And the drug like feed supplement, mineral mixture, they are also contain fluoride, and slowly when the fluoride get accumulated, this is going to produce the chronic toxicosis or fluorosis. Now we have to go through other point under the fluoride toxicity. The first important heading under this is toxicokinetic, similar to pharmacokinetic, means absorption, distribution, metabolism, and excretion of the toxicant is called toxicokinetics. So the first fluoride is going to come in the gastrointestinal tract when the animal get exposed by oral administration. Then it comes first in the GI tract, and in GI tract it get absorbed and distributed throughout the body. So massive part of fluoride get passively absorbed from the intestine, and half portion of absorbed fluoride get excreted out through the urine, and half of the absorbed fluoride from the intestine get deposited in calcified tissues like bone and teeth, and therefore the bone is called natural sink, like lead, means कि bone is act as natural sink not only for the fluoride but also for the lead, and about 96 to 99% of the absorbed fluoride which is not excreted out through the urine are going to be deposited in the calcified tissue bone, and therefore it is called natural sink. And where this is going to deposit in the crystalline structure or crystalline tissue, particularly the hydroxyapatite of the bone. So hydroxyapatite component of bone, which is also the calcium deposited there. So fluoride is going to replace the calcium in hydroxyapatite, apatite of crystalline structure of bone, and therefore the calcium will not deposited in the hydroxyapatite. So this fluoride get deposited in hydroxyapatite of the crystalline structure of bone as well as the teeth, and therefore this is going to produce the improper mineralization as well as the remodeling of the structure of both bone as well as the teeth. So this is very, very important, particularly for the chronic fluoride toxicity called fluorosis. Now we have to discuss the other, as we already discussed, the major route of excretion of the fluoride is kidney. So major chunk of fluoride get excreted out through the urine. So this is all about the pharmaco or toxicokinetics of the fluoride. Now we have to go through the toxicodynamics. This is not kinetic, this is toxicodynamic. So you have to write here toxicodynamics. Toxicodynamics. So this toxicodynamics means mechanism of toxicity. So the toxicodynamics means mechanism of toxicity of the fluoride. So we are going to discuss how this fluoride is going to produce the toxicity. So first we have to go through the acute toxicity of fluoride. So if the fluoride is in inorganic form, so this soluble inorganic fluoride, when it first come in the gastrointestinal tract, in acidic environment of the stomach, this inorganic fluoride get converted into hydrofluoric acid, that is HF, and the name is the acid. So acid is itself a corrosive in nature, irritant in nature. So therefore, this is going to produce the irritation and corrosiveness in gastrointestinal tract, and therefore, accordingly, you will get the symptom that is correlated to the corrosive and irritation property. This is not only that, under the acute toxicity, the fluoride is, as we already discussed, having the capability to bind with the cations, particularly divalent one. So particularly the fluoride ion, which is a highly electronegative element, is going to combine with the divalent cation like calcium, manganese, magnesium, also trivalent like aluminum, and therefore it disrupts the ionic balance of the body, and therefore it leads to toxicity. So when fluoride ion is going to bind with the calcium, they are going to produce the calcium fluoride. So therefore, it is going to chelate the calcium present in the plasma, and therefore it produces hypocalcemia. So this is very, very interesting. So this hypocalcemia is going to be produced, and because of this hypocalcemia, the heart is become problem, as well as it also affect the neurotransmission activity of CNS, because if the calcium is not there, the neurotransmission is not going to be, neurotransmitters are not going to be released properly, and therefore neurotransmission do not occur properly. So this is very, very interesting. Not only that, this, when the calcium is going to combine with fluoride, calcium fluoride is an anticoagulant. So this is going to produce the coagulant. This is going to produce the coagulant type of problem. So this is the another one. Next is not only going to bind with this one calcium, but also it affect or inhibit the action of enzyme, several enzyme. And one of the important enzyme is sodium potassium ATPase, or also called sodium potassium pump. So when this enzyme get inhibited, the function of this enzyme, this is usually present in majority of cell of the body, and the function of this, with the help of this, calcium is entering from outside to in sorry, potassium is entering from outside to inside the cell, and sodium is moving from inside to outside with the help of ATP, and that is why this is called sodium potassium ATPase. So when this enzyme get restricted or inhibited by fluoride, the potassium is not moving from outside to inside. Therefore, potassium level raised at extracellularly, and therefore it produces the hyperkalemia. Extracellularly more potassium is there. So this is going to become a problem. This is participated the hypomagnesemia, as well as the hypocalcemia is going to produce the seizure in the poisoned animal. Not only this inhibition of this enzyme or other enzyme by the fluoride, inhibition of cation, but it also a cytotoxic in nature. So because fluoride ion is cytotoxic in nature, it also affect the others enzyme like sodium potassium ATPase and other enzyme, and therefore it impair the utilization of glucose. So this is very very important. So we earlier mentioned this, calcium is going to combine with the fluoride to form calcium fluoride, and this is anticoagulant in the action. Therefore, this is going to produce the coagulative defect of the poisoned animal in case of acute poisoning. So these are the mechanism by which the fluoride is going to produce the acute toxicity, like inhibition of sodium potassium ATPase or sodium purge, then the binding with the calcium, hypocalcemia is going to produce, then heart get affected, then because of the inhibition of sodium potassium pump, this hyperkalemia is going to produce. This is going to bind with the calcium to produce the coagulation, so coagulate anticoagulant, so the coagulative problem is there. So also affect the other various enzyme and also impair the function of glucose. So this is the acute type of toxicity because of the fluoride, and this is mainly because of the high amount of fluoride is taken by the animal. Now we have to do this chronic toxicity. This is rather a common type of fluoride toxicity and called fluorosis. So this is because of slowly animal is going to take high concentration of fluoride from the feed or roughage or foragage, and therefore it accumulated primarily calcified tissue like teeth and bone, and therefore produce the fluorosis. So the main affected part of the poisoned animal are teeth and bone. So now we are going to discuss the fluorosis or chronic fluoride toxicity. So when the chronic fluoride toxicity is concerned to teeth, this fluoride is going to damage the amyloblast or odontoblast of dentine. So when there is damage because of the excessive amount of fluoride deposited there, I mean in the calcified tissue of the dentine, then it will damage the amyloblast cell or odontoblast cell of dentine, and therefore matrix form, matrix laid down by this formed by this amyloblast or odontoblast are not going to properly mineralized. So therefore, if the proper mineralization of the dentine developing teeth or dentine do not occur, then the teeth become weak, and this is called impaired mineralization of teeth. So simple, if you want to explain this fluoride toxicity upon the teeth, then you have to say this fluoride is going to replace the deposition of calcium in amyloblast and odontoblast, and therefore it has not formed proper matrix or matrix of these two amyloblast and odontoblast. So therefore no proper mineralization, that is it impair the proper mineralization of teeth. Because of the calcium is not going to be deposited, they deposited there the fluoride. And when this fluoride get deposited there, I mean in the dentine or developing part of the teeth, then the teeth become mottled or get become spotted, and it get color, it will give a particular color. So when this fluoride get oxidized, this give a particular color, brown or black discoloration of teeth, where the fluoride get deposited. And say you, by this means you are going to diagnose this is of fluoride toxicity. And this toxicity, I means concerned to the teeth development, that is the dentine development. If the dentine is not going to develop in adult animal, or teeth are not developing in the adult animal, then this is not going to be seen in the adult animal, because teeth is not going to be developing there. No amyloblast developing, no calcium deposition is in amyloblast or odontoblast, and therefore no fluoride deposition occur, and therefore in case of adult, this is not occurring. Now we have to go through the bone. So this is very very important, because bone is acting as a sink for fluoride as well as for the lead. So regarding this bone is concerned, fluoride is going to again replace the deposition of calcium. So because of improper deposition of calcium in bone occur, then this disrupt the osteogenesis, and inadequate matrix formation similar to the dentine, and therefore irregular mineralization occurs. So in simple, in one line, a skeletal fluorosis occur when the fluoride is going to check or inhibit the calcification. So there is no calcification of bone occur, so therefore it disrupt the, so in place of calcium, at the hydroxyapatite of calcified tissue, the fluorine is going to deposit, and therefore fluoride is going to disrupt the osteogenesis. So when the fluoride get deposited, this is going to form inadequate matrix, and if there is no calcium, this is become irregular mineralization of bone occur. And because of this irregular mineralization in absence of calcium, this is going to accelerate the bone reabsorption. So bone get reabsorbed, starting reabsorb to supply the calcium to the blood. Because there is no calcium there, there is fluoride get deposited in bone. So therefore it produces the osteoporosis. So because of the development of osteoporosis, the bone easily get fractured. And because of this deposition of fluoride in hydroxyapatite part of the crystalline structure of bone, bone remodeling get occur. So because of bone structure get remodel, this is going to give the abnormal structure of bone like exostosis or sclerosis. So bony exposition, particularly at the where the bone is developing, like long bone, particularly the locomotory part of the or more movement part of bone. This you have to see, like in the forelimb, hind limb, as well as the movable bone like mandible, like chest bone, sternum. You have to see there the exostosis of bone occur because of improper mineralization, because of the deposition of fluoride in place of calcium, and therefore it is going to produce the osteoporosis, bone remodeling, that is the exostosis. And this is by replacing the fluoride is going to fluoride ion is going to replace the hydroxyapatite, that is the crystal structure of bone substance that is going to produce the matrix of the bone. So matrix are devoid of calcium. In place of calcium, fluoride get deposited, and therefore the no proper mineralization, and therefore osteoporosis, bone remodeling, and exostosis occur, and bone easily get fractured. So this is the very big problem in the population or poison animal which is residing where the fluoride content is very high. So this is very important. So this is about the chronic toxicity of the fluoride or fluorosis. So as we also mentioned, actually this deposition of the fluoride is mainly occur in metabolically active bones, particularly long bones or bones of locomotion like hind limb, forelimb, or the bone which is movable or metabolically active like the chewing or breathing bone, like like mandible, like sternum. So these bone are get affected. So this is very important. And in long bone, particularly the periosteal surface of the bone, there in place of calcium, fluoride get deposited, and in periosteal surfaces when this fluoride get deposited, this is going to develop the exostosis, that is the bulging of the bone exposition occur. So this is about the mechanism of toxicity of the fluoride or fluorosis. Now we have to go through the diagnosis or toxicity. So toxicity usually occur when you will find that the concentration of this fluoride is 30 to 60 part per million, and diagnosis of fluoride toxicity, whether it is acute or chronic, as we earlier mentioned, the acute fluoride toxicity is rare. So usually you will find the chronic one in the animals. So the diagnosis is based upon the clinical sign and symptom, based upon the lesion you will find. It may be macroscopic, it may be microscopic. Then the laboratory diagnosis on the basis of presence of the fluoride in the blood, on the urine, or in the bone, or in the teeth. By this way you are going to diagnose whether the animal is having high concentration of the fluoride or not. By this way you are going to diagnose the fluoride toxicity. Now we have to go through the first one under the diagnosis is the clinical sign of the acute fluoride toxicosis. So this acute sign usually develop within the 30 minutes of ingestion. So as we earlier told, this is irritant and corrosive in nature, particularly the inorganic fluoride, because this inorganic fluoride is going to form the HF, hydrofluoric acid, in presence of the acidic environment of the stomach, and therefore the acid become irritant and corrosive in nature. So because of this is going to produce the gastroenteritis. So when there is gastroenteritis, this is going to produce the nausea, then vomition, then hypersalivation. So because of nausea, vomition, irritation, gastrointestinal enteritis, you will find the abdominal pain, and also you will find the diarrhea. And these all signs and symptoms are correlated because of the irritation property. And in case of ruminant, you will find the ruminal stasis as well as the constipation or diarrhea. You will find the symptom like this. So in case of acute toxicity, the animal die mainly because of the respiratory failure, because this is going to produce the dyspnea, difficulty in the disturbance in the breathing. And you also find the cardiovascular impairment, impairment. Why? Because this fluoride is going to combine with the calcium, so the calcium fluoride is formed, and therefore this calcium is going to promote the heart function and the neurotransmitter function. So therefore it affect the heart, like it give rise to arrhythmia as well as the cardiac arrest, and which finally lead to the shock. And we also this is going to produce the nervous signs like excitability, muscle tremors, and weakness. And the death in case of acute toxicity is because of the respiratory failure. So this is about the clinical sign concerned to the acute toxicity. Now is for the chronic toxicity. So chronic toxicity in case of livestock is divided into the two part, that is concerned to the bone, that is the skeletal fluorosis, and that is the concerned to the teeth, that is the dental fluorosis. So this is concerned to the livestock, and this is the chronic fluoride toxicity or fluorosis. And this will occur when animal or livestock is going to take the fluoride for several months or year. Then this is going to produce the fluorosis or chronic fluoride toxicity. So first we have to go through the skeleton or skeletal fluorosis. So this is going to produce mainly the lameness. So why this lameness occur? This is totally related to the mechanism of action of the fluoride. So in mechanism of action of fluoride, we earlier gone through that this calcium is going to be chelated or combined with the fluoride to form calcium fluoride, and therefore because of the lack of this calcium, this is going to produce the improper mineralization of the bone, and the developing bone or bone of the locomotion or highly metabolically active bone get affected, because their bone are not get properly mineralized and get produce the osteoporosis, and this osteoporosis is going to produce the fracture, as well as because of improper mineralization this is going to produce the exostosis. And because of this bone problem, weakness of bone, animal are not sustain the weight, and therefore it is going to give the, when animal is going to give the weight on the bone, this is going to produce the pain, and therefore the animal get lameness. So lameness is, it is also going to produce the stiffness, then it is going to produce painful gait, then this is going to give the improper posture. So because of the lameness and pain, animal are going to feel uncomfortable while moving. So this is very very important. So we earlier mentioned this is going to produce exostosis of particular the periosteal layer of the bone, and therefore this is going to produce thickening and enlargement of the other bone also, like sternum, that is the highly metabolically active one, sternum, mandible, rib, spine. And we earlier also developed discussed that is bony exostosis of leg, and also you will find swelling of the limb. Also you will find this is with the movable legs, like this is problem with the legs, forelimb, hind limb, the metacarpal and metatarsal get affected, phalanges get affected. So these all are symptom are correlated with the mechanism of toxicity of the fluoride. This is going to give rise the improper mineralization, then osteoporosis, then therefore this is going to reproduce the lameness, then therefore produce the pain, therefore produce the thickening, and therefore because of this is going to give the problem to animal are not going to sustain the weight, and if going to sustain the weight, this is going to produce the lameness. So you will find the this type of symptom concerned to the chronic fluoride toxicity concerned to the skeletal fluorosis. Then we already discussed osteofluorotic. What is this? This is proliferative osteoporosis that we already discussed. This is going to produce the osteoporosis, proliferative osteoporosis, which is lead to the spontaneous fracture that we already discussed. Again, this is the repetition, and finally animal get died. So this is all about the chronic fluoride toxicity concerned to the bone. Now we have to go through the teeth. So we already discussed with the toxicodynamics, and this is also the improper mineralization of bone matrix in dentine occur, enamel occur. So therefore because of the improper mineralization of the dentine or amyloblast or odontoblast or dentine occur, this is going to give the spot mark on the dentine, that is over the developing bone, that is we call it mottling. And the loss of the dentine occur because in place of calcium fluoride get deposited, which is going to give is the patchy loss of dentine, and you also find the spot mark. Teeth are lusterless, means because of deposition of the calcium, fluoride get deposited, and the luster of teeth, now you will not get the luster of teeth. Luster of teeth become not visible. Then this become also pitted. Then in case of more severe cases, then the teeth is not is not in proper color, it become brown, particularly at the area of dentine, and and in final stage you will find the complete deformation of the dental tables or shading of the teeth occur. So teeth, when teeth is going to be shed, how the animal is going to take the food. So when the animal teeth get shed out, the animal is feeling difficulty while prehending the food or while swallowing of the food. So this become a very big problem, and this is concerned to the chronic fluoride toxicosis or fluorosis concerned to the teeth, and we already discussed concerned to the bone. Now we have to go through the lesion. So you will find mainly the lesion that is concerned to the bone as well as the teeth. So when you see the teeth, then you will find the teeth is radiolucent region. Radiolucent region. So when you pass out the X-ray, you will find the darkness appear because of the deposition of the fluoride in odontoblast or amyloblast or matrix of the teeth. Then this give rise to the radiolucent region. Now we have to go through the bone. So bone, like particularly metacarpal, metatarsal, then the mandible, then the ribs, then the spine get affected. So there you will also find the lesion, that is the exposition of the exposition you will find there. And affected animal, there you will find the area become large and the bone become chalky, and you will find the periosteal surface is roughened because of the exostosis of the bone. Now we have to go through the histopathological changes. This is very, very important. And when you see the bone, you will find the cortical thickness because of the deposition of the fluoride. That is exostosis is there. Then periosteal hyperostosis is there. Uneven mineralization because of the deposition of fluoride. Then it also started the bone reabsorption, that is the osteoporosis occur. And this is all about the lesion, all about the clinical sign, all about the toxicokinetic, all about the toxicodynamic. Now we have to go through the laboratory diagnosis. Laboratory diagnosis we already earlier discussed. We have to see the level of the fluoride in the bone, in the teeth, in the tissue also, in the blood also, in the urine also. So when you will find the high level of fluoride in these part, you will say that the animal is suffering from the fluoride toxicity. And you also have to go through the radiographical examination, and while radiological examination you will find the dental, when you see the teeth, then you will find the radiolucent region. So and also you have to see the microscopically. So now we have to go through the last part of this fluoride toxicity, that is the treatment. So treatment is all again divided into two parts: acute treatment and chronic treatment. Rather, chronic treatment is not much more effective because the calcium is deposited in the natural sink, that is the bone. So the fluoride is going to release from the bone very slowly, and it is taking very much time. So this treatment, chronic fluoride toxicity treatment is rather somewhat not very give rise to very good result. But of course the animal will slowly improve when the fluoride is going to be released from the natural sink bone, and therefore the animal will feel better and better. But acute toxicity, in case of acute toxicity, it is not well deposited in these two parts. Then acute toxicity you will find the better result, and we will treat the patient symptomatically, based upon the symptom you are getting in the poisoned animal. So poisoned animal, first we have to treat by giving the calcium compound. Why? Because if the calcium is present in the gastrointestinal tract, that fluoride is going to be trapped by the calcium, because this is going to bind with the calcium to form the calcium fluoride. And because of this we are going to give the drug like divalent or trivalent cations like calcium compound or aluminum salt. A calcium compound like calcium gluconate we are going to administer orally, which is going to bind with the fluoride present in the gastrointestinal tract, and that is going to be taken out through the feces. And if still you are going to give the better way by treating this by many pathway, then you have to also have a better option. Along with this treatment, you have to lavage the GI tract, wash out the GI tract, or you have to aspirate by giving the lukewarm water and take out, remove the content of the GI tract by the gastric lavage or gastric aspiration. Now we have to go the other way of treatment. We are going to give the quinidine. So what is this quinidine? Quinidine is going to block the potassium efflux by blocking the pathway sodium potassium ATPase. So quinidine is going to block block this sodium potassium ATPase pathway, and therefore the potassium level outside the cell will not rise, and therefore this is going to relieve from the high level of potassium outside the cell, that is the hyperkalemia, because it blocks the potassium efflux by blocking this sodium potassium ATPase enzyme or sodium potassium pump. Now we have to proceed further. We have to treat the patient by giving the calcium. Why? Because hypocalcemia occur in the patient that is poisoned with the fluoride, because this fluoride is going to bind with the calcium and produce the hypocalcemia, and therefore hypocalcemia should be treated by giving the calcium compound, that is the calcium chloride, by giving the intravenous administration. We have to also go through the dialysis also. Now third and the last part of this treatment is chronic toxicity treatment. Acute toxicity treatment we already discussed. Regarding chronic toxicity treatment of the fluoride is concerned, this is not much effective because this is get deposited in the bone, that is the natural sink of the fluoride. So this is not much more effective, but we are going to give the drug like for tolerance to fluoride, to develop the tolerance to fluoride by giving the elements like calcium or calcium compound, phosphorus compound, or vitamin D to increase the tolerance with the fluoride. We are also going to give the element or compound which chelate the fluoride, like the aluminum compound, aluminum sulfate, aluminum chloride, calcium compound like calcium aluminate and calcium carbonate. Also the other compound defluoridated phosphate. These all are going to be administered orally, and these all are going to combine with the fluoride, and therefore it reduce the absorption of fluoride. And those which are present in the blood, with that this aluminum and calcium chloride is going to bind with the fluoride, and this is going to excrete out the fluoride. And the supportive therapy with the steroid, antibiotic, analgesic, and fluid therapy we have to give to dilute it and to relieve from the symptoms. This is all about the fluoride toxicity. In next class we are going to discuss with the next toxicant. That's all.